we can see you.
Okay,
Well,
all
I
right.
just said, we hear you, we see you.
All right, fine. So, Mark, I originally, when I called you this afternoon, I was just going to be on the phone, but Mary Ellen let me use her iPad,
I heard.
and so I'm on that. So you can cross off my name on your telephone.
No, we see you. It says, let me see where, do we have you here? Paul. I got a
Hi,
screen.
Fred.
I am looking at the bottom of my screen and I can't find the raise hand icon.
You can't find what?
The raise hand icon.
It should be
Did
under
you look at-
reactions.
Did you go to participants first?
Oh, under reactions, okay.
Participants first.
It's a green with an arrow pointing up.
And then there's a column on the right-hand side.
No, there isn't. I'm sorry.
That you didn't do participants. Go to the bottom.
I can't
click on-
find participants. I would gladly do it if I could find it.
Go to
Excuse me.
the bottom of
It's on the bottom center.
Vinny,
Fine.
various operating systems sometimes have things slightly
Okay.
different. So it can be, Peggy, you're working on a Windows machine.
Yeah,
There
I've
should,
got mute, I've got stop video, I've got invite, I've got share screen, I've got actions, but no participants. I can see you all.
Yeah, we see you too.
that's strange that you don't have participants there, because
I
usually
did
it should be
ask,
right
I
next to
can't
share
find it.
screen.
I can't find it this time.
When you go down to the bottom of your screen,
It's mute, stop video, invite, share screen, reactions, more. That's it.
there's no participant.
Hit more. Click on more and see what's there.
Okay, here it is. Thank you.
Okay, and then now, if you look over to the right-hand column, you could raise your hand. Okay. Walter, you got to stop grinding your teeth.
Clear my throat.
Okay, I'm going to step away for a moment so you people could keep chatting, and then we'll start the meeting.
If you're not speaking at the moment and don't have anything to say, please mute yourself so that there's not a lot of background noise.
How do you mute yourself?
Can I
Maybe
speak?
cursor down to the
Can you
bottom
hear
on the
me?
left-hand side. There should be a microphone icon, and it should say
I'm on a
mute.
regular telephone.
All right, I'll take care of those.
Okay.
How's everybody doing during these tough times?
I'm doing well. Little stir
That
crazy.
means I am muted, right?
Have enough toilet paper?
Sure.
Whoever
Did
just said
anybody
that
see
means
Saturday Night Live a few weeks ago when they had a skit about Zoom? It was hysterical.
Okay, so I enjoy these online or video, whatever you call it, because I could be mellow while you guys annoy me. So,
Well, Vinny, are you
Mark-
wearing pants?
Mark, are you? Yes, I
Oh, Dimitro, you got thin.
okay, everybody, we're gonna go live streaming. So
Okay,
let's.
good.
Go ahead, Vinny.
Okay, so good evening, ladies and gentlemen, and welcome to another live streaming of Community Board 5's monthly meeting. I welcome you, and Donald, would you please do the Pledge of Allegiance with the flag?
I pledge allegiance to the flag of the United States of America
And to
and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Thank you very much. Thank you. And I apologize to the public because you can't be physically with us, but that's a problem with electronics. And hopefully, we don't think that our June meeting will be face-to-face either. Joe Nazarino was checking in, and we think it's going to be a repeat of this. So Well, we'll talk about that later. The first item of business tonight is a presentation by Chano on the coronavirus. Che, are you there?
Yes, sir, I am here.
Please.
All right, good evening, Committee Board 5. My name is Che No from the New York State Department of Health and Mental Hygiene. It's a pleasure to join you once again. It's been a while since we saw each other, and my hair is getting quite long. My wife wants to shave it off. I don't want her to, so it's going to stay as it is. All right, so today I have a presentation for you. So I'm going to click share screen. Let's see how this baby works. All right. All right, is this working?
Yes. We see it.
Yep. All right, let me go into slideshow. From the beginning. All right, so today I'll be giving you some, information about what's going on with this COVID-19. So the disclaimer I must make, because the situation is rapidly changing, as is our understanding of the 2019 novel coronavirus, COVID-19. So it's current as of today, it's 3 p.m. And I'll be covering where we are, general overview of COVID-19, what the state and the city is doing, and how you can help. Where we are. So over the past few months, we had several things happen, right? We had the first confirmed COVID-19 case in New York City, and then the number of daily cases, hospitalizations, and deaths went up, and now it's decreasing. But we can't let our guard down. We still have widespread community transmission of COVID-19. And what we know for sure is that physical distancing, face coverings, and good hand hygiene remain essential to stopping the spread of COVID-19. And right now in the world, we have over 4 million cases. The number is probably going to go up tomorrow morning, unfortunately. And we have a lot of deaths too, not just here in the States, but elsewhere too. Over 293,000 reported deaths, which is a tragedy in itself. In the United States, we have over 1.3 million, probably 1.4 million cases in the United States, over 83,000 deaths, over 185,000 cases in New York City alone, and over 20,000 confirmed and probable deaths. And in New York State itself, we have over 153,000 cases in New York State. And many people who had COVID-19 were not tested and are not reflected in the data. These are the numbers of people who were tested. So as I covered back in March, was it in an in-person meeting, coronaviruses are a large family of viruses that cause illnesses ranging from the common cold to severe illness. And the name coronavirus comes from its shape. It looks like it has a crown. And COVID-19, the disease that's caused by SARS-CoV-2, is new. It was discovered in December of 2019, so it's only been 5 months. So we're still learning a lot about it. And vaccine and treatment research is underway. So who's most at risk? People 50 years of age and older, people 65 and older at the greatest risk, and people who have underlying health conditions, including lung disease, moderate to severe asthma, heart disease, obesity, diabetes, kidney or liver disease, cancer, or a weakened immune system are susceptible. So this COVID-19 disease, the virus is transmitted from people who are in close contact within about 6 feet with someone with COVID, when the person with COVID-19 coughs or sneezes, or when they talk. A person with no symptoms can spread the virus. COVID-19, just like other bacteria and viruses, can live on surfaces. The virus can be spread if someone touches their eyes, nose, or mouth with unwashed hands. So let's say you touch doorknob, or on the subway or in the supermarket, you grab a shopping cart handle and then you do your thing and then you touch your face with it. That's not good. So the symptoms, so in the beginning we said, the symptoms were, shortness of breath, fever and so forth, but a wide range of symptoms has been reported since then, ranging from mild to severe. The most common symptoms are still fever, cough, shortness of breath, and sore throat. And less common symptoms may include headache, loss of taste, feeling achy, and having diarrhea. So this is a new topic that I'm going to be discussing with you. This is called the Pediatric Multisystem Inflammatory Syndrome, or PMIS. It's a rare inflammatory condition in children. It's potentially associated with COVID-19, but the connection is unclear to this right now. The symptoms are most children have several days of fever along with other symptoms such as irritability or sluggishness, abdominal pain, vomiting, conjunctivitis, or red or pink eyes without any discharge. If you get, the pink eye, usually, it's accompanied by discharge, yellow discharge, but it doesn't happen here. Enlarged lymph nodes or glands on one side of the neck, so your lymph nodes are here, but they swell, so it looks like they have a bump on their neck. The children were also found to have red or cracked lips or red tongue that looks like a strawberry. This is literally looking like a strawberry. It's the tongue is like all swollen, all inflamed. It's red as a beet. Swollen hands and feet, which might also be red, and rashes. Please, if your child has several days of fever plus other symptoms, go to the hospital or call 911 if it's an emergency. We're taking this very seriously. We first reported on this maybe late last week because it was the first time we saw it, and then we saw case counts go up, and we see that it's causing a dramatic effect. We're still trying to find out more about it, but if your children or if your nephews, nieces are having fevers and different symptoms, please have them contact the providers, or if it's an emergency, dial 911 and go to the hospital, please. So with regards to testing, there are two different types. The first one is the virus test, which is conducted by a swab or saliva test, which shows if you have COVID-19 now, and the antibody test, which is a blood test that shows if you may have had COVID-19 in the past. So the antibody test checks for antibodies, and basically they're special proteins produced by body's immune system to the virus that causes COVID-19. But the test doesn't work if you're sick now or if you're recently sick, and the test does not tell you if you're immune to COVID-19. Whether you had or may have had COVID-19 in the past, it shouldn't change your behavior because we don't know if you can get it again. We don't know if the antibodies that you may have may protect you. We don't know for sure. We're still trying to figure that out. So take appropriate precautions as usual. So New York State right now is on pause. It's banned on gatherings of any size for any reason. Only essential businesses can operate. 100% of non-essential workforce must stay home. Outdoor recreations are limited to non-contact activities. Schools, colleges, and universities are closed for the remainder of the school year. So this pause act is supposed to expire on May 15th. The governor has the authority to extend it, but he hasn't done so yet. I'll discuss this more later on in the slide set because we're taking several actions to prepare for this. Right now, we're, as the agency itself, as a department, we're enhancing surveillance to track disease spread. We're also educating the public through webinars like this, virtual town halls, social media, guidance documents, and media campaigns. I'm sure if you're watching television or watching YouTube, you're going to see a lot of our commercials, unless you pay for YouTube, of course. Then you don't get any advertisements. But we're flooding the waves with our announcements. We're also providing guidance to doctors, hospitals, nursing homes. We're also testing at our public health laboratory, and we're also we're distributing medical equipment and supplies to healthcare facilities, and we're sending volunteers. And finally, unfortunately, we're also planning for the future phases of the pandemic. What the city is doing right now, where the city is providing childcare for essential workers. They're providing free meals from 7:30 a.m. to 1:30 p.m. at local schools. They're also providing paid leave for people under quarantine or isolation, temporary suspension of debt collection for students, student debt, medical debt, and other loans. And we're also having a freeze on COVID-related evictions until August 20th, as extended by the governor himself. For other resources, please visit nyc.gov/helpnownyc. So to reopen, reopening is a very complicated question. And the state has set various criteria that New York City and other regions must meet before each region can start to ease work and physical distancing restrictions. And they're in the following areas: decline in new infections, decline in hospitalizations, decline in deaths, increased hospital capacity, equipment beds, increased diagnostic testing capacity, and increased contact tracing capacity. So the government is working towards meeting all these goals, but we're still in progress considering the severity of this outbreak, of this pandemic. And the mayor has come up with sector advisory councils to inform plans to restart the economy and resume daily life. There are 6 councils dealing with nonprofits and social services, public health and healthcare, faith-based, construction and real estate, education and surface transportation. And we're also having the COVID-19 hotel program. So we're trying to provide alternate residences for people who need to isolate, who need to quarantine, but they can't because of their living conditions. So we're trying to provide for that too. And the mayor recently announced the New York City Test and Trace Corps to oversee case investigations, trace and monitor contacts, and manage data and inquiries. I won't get too far into this. Basically, it's a joint initiative between the Health Department and the Health and Hospitals Corporation. I'm sure you saw a lot of the news. So that's what's going on. So to protect the communities, what you need to do: physical distancing, good hygiene, and I'll cover what to do if you're sick, when to seek care, and other items concerning this pandemic. So all New Yorkers must practice physical distancing to slow the spread of COVID-19 because the virus is spread in close contact and close proximity. So people need to stay home as much as possible, keep at least 6 feet between yourself and others, avoid all unnecessary travel, events, and interactions. And if you're not sick, only go out for work if you're an essential worker, or if you need to do non-contact exercise, or get necessities, or get essential medical care. As the weather is getting warmer, we're seeing a lot of people driving. I take the LIE and the Grand Central. A lot of cars every single day. The amount of cars are increasing, and our doctors are worried because people are going to places that they shouldn't need. They don't need to go to, and I get it. I mean, being stuck at home, it's boring. It's tolling. It's depending on what kind of living conditions you may have, or depending on the family members or the roommates, it may be stressing. But I understand that. But we really need to limit unnecessary, outside visits, and it's every day the mobility count is increasing, and we're not sure what's going to happen. And thankfully, most New Yorkers that are sound-minded are, following our advice, and that's that we thank you for. For face coverings, per the governor's orders, all New Yorkers must wear a face covering when outside their homes or unable to maintain at least 6 feet of distance from others. It does not replace physical distancing and good hand hygiene. It's just a safeguard to protect you and others from spreading the virus if you have, or from catching the virus. And a face covering includes any well-secured paper or cloth that covers your nose and mouth. Wash your hands often with soap and water for at least 20 seconds, or use alcohol-based sanitizer. Please understand that the first option you should always go to is soap and water. Soap and water. Using soap and water to wash your hands is the most effective solution to get disinfecting your hands. The alcohol-based hand sanitizer is a secondary option. It's used when you can't find a sink, or if you're outside and you have to engage in activities. It's for that purpose. It doesn't replace soap and water. Don't shake hands. Do not touch your face with unwashed hands. Avoid close contact with people who are sick. Cover your coughs and sneezes with a tissue or sleeve, not with your hands. Don't go like this, sleeve and, sneeze into your sleeve. And monitor your health more closely than usual for cold or flu symptoms. So before, it's allergy season too, so it's easier to get confused. But if you're feeling under the weather, if you're having a sore throat, but, let's say if you have allergies in the past, but this year you're sneezing a lot, but your throat is also sore and you're feeling a bit hot, yeah, you might want to, keep tabs on your health, and if it's concerning, please consult with your primary care physician. We have the poster going around. So who should seek medical care for COVID-19? So most people with mild to moderate symptoms can safely get better at home. But if the symptoms don't go away for 3 to 4 days, or if you have medical concerns, consult your doctor. And as I stated before, if you're 50 years of age or older, or have underlying conditions, please consult your doctor, because your doctor will try to maintain your, sorry, I just got train of thought, try to monitor you more closely. And if you have telemedicine, a lot of the insurance companies are supporting telemedicine. Call or email your doctor or and use telemedicine. Thankfully, through the city, I have telemedicine. It's been pretty useful. And it's nice. You don't have to step outside. You can just talk to your doctor in the living room. You don't have to, it takes out the hassle. It's nice. And so how long do you need to stay at home if you have been sick? So if you're confirmed to have COVID-19, if you have tested positive, or if you may have had COVID-19, you have to stay home until all of the following conditions are true. It has been at least 7 days after your symptoms started. You have not had a fever for the prior 3 days without the use of fever-reducing drugs like Advil, Tylenol, and your overall conditions have improved. If you're sick, don't leave your home except to go to your doctor's office or get essentials like groceries. Please, please, please have a face covering on. Stay at least 6 feet from others, and follow good hand hygiene. And if you need to, walk if you can. Don't enter crowded stores or transportation, and please don't have visitors come to your home. That's the catch. If you're sick and you have other people living with you, separate yourself as much as possible. Stay at least 6 feet apart from others. Stay in a different room. Move seating and other furniture around to keep distance. If you have a separate bathroom, use it. If you share a bathroom, disinfect frequently touched surfaces after each use. If you share a bed, have someone sleep on the couch or somewhere else. And as stated before, follow good hand hygiene. And don't share personal household items such as glasses, cups, eating utensils, and towels because they all come in contact with your hands or with your mouth or wherever. So not just your bathroom, but also the doorknobs, phones, and anything that you could think of, please disinfect them. If you need to be within 6 feet of someone at home, wear a face covering. So with many people getting sick with COVID-19, you may be afraid of going to the doctor or the hospital. I mean, I'd be concerned too, but it's important to seek care because if your symptoms are serious and you don't seek care, who knows what's going to happen? You have to take care of yourself. So if your symptoms are serious, but it's not an emergency, call your doctor first. And if you're not feeling well, if you're feeling, shortness of breath, if you're having chest pains, please, please, please dial 911 and, seek emergency care. The hospitals are ready for that. So we've had several cases where people didn't reach help in time, and we don't want that to happen. So like I said before, if you're having the following symptoms, like shortness of breath, pressure in the chest, lethargy, so basically inability to stay awake, blue lips or face, difficulty speaking, sudden face drooping, upper abdominal pressure or pain, any sudden or severe pain or any other emergency condition, please seek care. And for people who don't have primary care doctors or have insurance, they can use New York City Health and Hospitals. They can call 311 or 844-692-4692. And we, as a health department, we monitor different statistics such as mental health, counseling calls and different stats. And we see that stresses are going up, be it economic, be it social, be it family. Being confined with someone else, it can be difficult. I love my wife to death, but being in the same place as her for 24 hours straight, yeah, it's kind of taxing. But, it's natural to feel overwhelmed, and it's natural to feel sad, anxious, and afraid. And don't forget to, keep in touch with your friends and family through telephone, social media, and video chat. I mean, what a world we're living in. We have smartphones that we can, use to talk to friends from all over the world at any time of the day. And also, if you want to talk to someone that are trained counselors, you can call NYC Well. It's confidential. It's free of charge, 24/7. If you have different language speaking needs, you can use that too. You can call 888-692-9355, or you can text WELL, WELL, to 65173. You can also chat online if you don't feel like talking. Also, the state's offering an emotional support helpline with specially trained volunteer professionals. The number is 844-863-9314. They're open 7 days a week, 9 a.m. to 10 p.m. And this is probably the final topic I'm going to cover. We saw some health disparities with this outbreak. we saw that Black and Hispanic Latino persons account for a disproportionate amount of COVID-19 cases, hospitalizations, and deaths. And disparities may be related to higher rates of pre-existing conditions, difficulties in practicing physical distancing, healthcare access issues, other social determinants of health, and structural racism. And what the city is doing right now is that we're reaching out to other people, people who are experiencing housing instability. So nearly half of single adults living in shelters have been moved into hotel rooms for the time being. We're also pushing out media campaigns in 15 different languages for people who may be limited English proficient. We also increased testing capabilities at NYCHA sites. And the mayor created a Fair Recovery Task Force to address inequities in our economic situations. There's a lot of fake news going around. There's a lot of fake news. So it's important to separate facts from fear and guard against stigma. A lot of the information that we see on social media and some news reports, they're not based on facts. They're based on presumptions. They're based on false information, prejudices, you name it. So what we need to do is we need to treat each other with respect, and we can't just single out people based on race, ethnicity, or what country they're from, because it creates distrust. We're all in this together. And for people that need help, they may not seek it, and that's not, it may lead to unfortunate outcomes. It may contribute to retaliation and violence against people, as we've seen before, as we see in different parts of the city. It can cause mental health and other issues, and it also breaks our communities apart. And let's take that into consideration, and let's treat each other with respect, and let's be nice. It's a difficult time. So this slide I covered last. It's illegal to harm and harass. It's illegal for restaurants and other establishments to discriminate or make them feel unwelcome. It's illegal for a person's employer or coworkers to discriminate against or people because of their race or what country they're from. However, it is legal for storefronts and establishments to not allow entry to people who are not wearing masks. That's part of the governor's executive order. So it is legal to bar people who are not wearing masks. And for people who may have experienced discrimination, they can call 311 and say human rights to be connected to an investigator. The Commission on Human Rights investigates claims and can impose fines and compensate people for harm. To stay informed, please visit our website, nyc.gov/coronavirus. Our direct portal is nyc.gov/health/coronavirus. If you have a smartphone, or if you have if you text with your phone, you can text COVID to 692-692. Periodic updates are sent regarding the situation, and we'll release the information periodically and as much as possible. And let's go over the point. All New Yorkers should stay home as much as possible. If you leave home, wear a face covering and practice physical distancing. Practice good hygiene. If you feel sick, don't wait, call 911 or go to the hospital, and stay connected with neighbors, friends, and family, and treat everyone with dignity and respect. Thank you.
Thank you, Jay. That was excellent. Where am I? I can't find myself. Hold on.
You're right on your couch, Vinny.
Yes. No, I'm trying to get to so I could relate to everyone. There I am. Unmute. So, thank you, Jay. Today, my general practitioner called me to see how I was doing. And because of my age, he gave me a script for the full test, whatever, full corona test. But none of the laboratories will do it. They refuse to do it. They're telling you to go to a doctor or a hospital. So what should people do if they get a script for a full corona test, not just the drive-up blood test?
Yes, so For people who are experiencing symptoms of COVID-19, a lab test can be arranged. So that's done by the.
That wasn't a question.
Yeah.
Hold on, people quiet. Go ahead, Jay.
So for people who are who are hospitalized or who have symptoms of COVID-19, they will be tested for the lab test, which is a swab test. For the people who are written prescriptions for antibody tests, we're still working on that. We also have testing information for the city-run programs at nyc.gov/coronavirus. This antibody testing and just the testing effort itself is we're still working on making it wider. So for individuals who have questions, they can feel free to reach out to 311 and be connected to Health and Hospitals, which is administering the program.
Very good, thank you. Anyone else have a question for Jay? Raise your hand first, electronically, please. No? Okay, thank you.
Marianne has a,
has a question. Hold on.
Were you kicked out?
Marianne, go ahead.
Hi, I have a question about social distancing and who enforces it. I noticed certain precincts enforce it more than other precincts. So who's responsible for enforcing it? When I go into the 102 precinct, I see officers all over the track making sure that social distancing is enforced. When I go into the CB5 area in the 104 precinct, the track is crowded with people. Soccer, which is a contact sport, is being played. And we have school safety officers on the other end of the park when nobody's there. So who's responsible to making sure these people are enforcing these laws?
Okay, hang up.
Hang up, okay.
So what's your...
Oh, sorry, please go ahead.
Go ahead, Jay.
Yeah, social distancing right now at present is enforced by the New York City Police Department, but it appears that we may be going away from that model. So the mayor has brought up plans for social distancing ambassadors. So basically, they are city employees; they're not uniformed. They will be going out to different locations where people tend to congregate, especially parks. And we'll, educate people on, the importance of social distancing and hand out masks and facial coverings if able to. As for the disparities in enforcement, I cannot speak to that because that matter itself is coordinated by the patrol bureau. So if we have any representatives from the police department here, please feel free to address. But I will take your concern to my superiors and have this looked at.
Thank you. Ed Littell.
Yes, hi, Che. This is Eddie. With the homeless being removed from the trains and buses, I know some of them, they can refuse, help. But with the situation with COVID, once they're removed, some may go into the shelter system. What happens to the ones that are refusing? Are they going into the station? Are they going out on the streets, or are they being taken to a shelter or to a hotel room that they're providing for them?
So the individuals that are being moved into the hotel rooms, they're individuals. They are already registered with DHS. They're already registered as clients, and they're And as for the people who are being escorted off the MTA trains, they're supposed to be sent to shelters. But as for the people who refuse services, I cannot say for sure. I have to find out. I'm sorry. It's out of my specialty.
Okay, thank you. So Richard, who's Richard's iPhone? Richard's iPhone. You have a hand up. Who is it?
Richie Huber here.
Okay, hang up and talk.
Okay. I'd like to know by what exactly law did the city council or the state legislature pass for this social distancing, and where in the Constitution did we suddenly find this, and exactly how or what gives any right or authority to enforce this?
Hold on. Who's speaking? Che?
Yes. So the order came from the executive order that multiple executive orders that the governor signed. It is by his authority he is able to impose this law on the state, and basically the state is his domain. So we are abiding by that executive order.
But Chair, I think Richie's point is that he didn't declare an emergency. He just issued an executive order. And the executive order might not be sufficient without a declared emergency. So that's the question.
Yes. As for that, I think the governor did declare a state of emergency. Yeah, on March 7th, he declared it a disaster emergency through the executive order number 202.
Okay. That answers that. Thank you. Anyone else?
I have a question. This is Mariana Zero.
Your hand's not up.
Because I can't put my hand is up, but I'm on my regular house phone, so you're not going to see it.
Go ahead.
I could speak?
Yes.
Okay. I have a question. Is the ice cream trucks that go around considered a necessity? We have one that comes every day, no mask. I mean, a lot of the people on the block have asked him to leave, but I know he goes from block to block. I reported it to the police, but they say call him when he comes, but he's, here for a minute and then he's on the next block. I mean, is that considered a necessity, the ice cream trucks? It's not Mr. Softy, it's a Frosted, it's called.
We have them here too.
Yeah, so mobile food vendors, by the nature of their business, they're serving food. So for the food industry, they're considered essential businesses. Now, as for this ice cream truck not following by the mask guidance, or I'm not sure if this truck is even licensed by the city, that we'll have to discuss. So
I've taken pictures and I've sent it to actually Brian Barnwell's office as well as to the 104th precinct. But he still comes around, and it's like I said, no mask. He's going from block to block serving ice cream. Mm-hmm. Kids now, there's another problem going on with their unique disease. And it just seems like I said, on my block, a couple of men have gone over to him and told him to keep on moving. But you can hear him from block to block.
Right. Can you send me the so send me the details and the photos. Send it to the board, and the board will send it to me. And we'll
okay, I'll do that.
We need the license plate because he comes
I have that also. I have a picture of the license and his truck and him with no mask.
He comes around here, and I think Kenny Rayberger sent out a little message about stay away from the Softy truck because no one knows where he takes care of his personal business. So.
Well, that's another point. I didn't think of that one, yeah. And all you hear is that, hello.
Yeah.
Oh, my Lord.
All right, thank you. So
okay, thank you.
I have another hand up. Who is Tammy Sanchez?
Walter. Jay, I have a question for you.
Walter. That's a good name for you.
That's my wife. Sometimes it gets a little confusing when
louder, Walter. We can't hear you.
Sometimes the governor and the mayor disagree. So, Jay, I just want some, guidance with you. Who's going to be making the final decision on, when things will open, how we should act? Is that going to come from the mayor, from the governor? How does that work?
As for the reopening itself, I think it's going to come from both of them because they reached a consensus where New York State, the territory is so large and every region is different. The case counts, the hospitalizations, and what's going on, it's different for every region. So they're trying to figure that out.
Well, the city park is under the city. So is the mayor going to make that decision in the end, or is that going to be made by the governor?
Oh, man, that's a good question.
That's a legal question because
indeed
it's federal, state, and local, and neither of the two lower could supersede the upper. So if the governor declares everything is open, the mayor cannot declare anything different than what the governor does.
Correct. So as a compromise, the governor has laid out the plan in different stages, and each region will open, separately. So they're looking at the central region, Hudson Valley, and more upstate areas to open first. But as for New York City and Long Island, it's still under discussion because each jurisdiction has to meet that certain criteria that the governor lined out.
All right. I mean, so we could have federal parks open or federal beach open, and right next to it, a city beach might not be open.
Correct.
Maybe, but the feds may leave the parks closed in deference to the state authority.
No, Che, we saw that last weekend at Reese Park. Reese Park was open.
Right.
Rockaway beaches were not.
Mm-hmm.
So, and it goes back to, the locality, the states and communities cannot supersede the rules of the federal government.
Right.
So what Walter is inferring is there's going to be a major problem this weekend with Reese Park being opened and Rockaway being closed. So how is the mayor going to approach this problem?
I mean, I wish I had an answer, but unfortunately, I do not work for the mayor's office.
All right, I'm good. That's all I got. Thank you.
Thank you. Anyone else?
Then how do I get recognized? You just told.
Who's that? Did you raise your hand? Who's talking? Click on your name and raise your hand.
Fred is on the telephone.
I'm on my iPhone.
Slow down. Okay, hold on. Go ahead, Fred.
Yeah, I'm on my iPhone.
Go ahead, Fred.
Yeah, the boardwalk and the beach was open this past weekend. They had closed it a couple of weeks ago, but it's been open again.
No.
So the police are sitting there, but they're letting people, most of whom are not wearing, well, 50-50 maybe wearing masks. And they're on the boardwalk and they're on the beach. The police are there, but they're not stopping anybody.
Well, I understood that they were allowed on the boardwalk, but not on the beach. And similar to what Marianne Latanzio said before, the local precincts are not really enforcing this separation or, staying away from each other. So it's something that's a local situation. All right, I have Paul first and next. Paul next. Paul? We don't hear you, Paul.
I got it.
All right. On Walter's question of jurisdiction over parkland, the entire city of New York is a creature of the state. And so if the state has no decision on a particular matter, and the governor hasn't said anything, then the mayor can do what he wants. However, the mayor cannot issue a declaration or do anything that is going to be countermanded by the governor. So the governor is supreme if he wants to do it. If he's silent on the issue, then the mayor can say what he wants.
Okay, thank you.
On the issue of Rockaway Beach, what I would suggest, maybe Gary can call. Is John Ganska still the district manager of Board 14?
Yes.
Paul, you want to do Paul? We're not into committee work yet.
No, this is not a committee met. This is the issue of
Paul. It's committee work right now. We're talking. All right. Hold on and bring it up later, please. I want to keep this meeting moving properly. All right.
Vinny, are you there?
Hold on. I have Fred Hefferly first.
Okay.
Fred. Hello, Fred. Fred. We lost Fred.
Vinny, this is Ken Rayberger.
Hold on, Ken.
Okay.
Kenny, you got to wait in line, and you didn't raise your hand.
Yeah, I know, but what happened is
hold on,
I can't. No, I can't get into Zoom. so I'm
Hold
not there.
on, please.
Okay.
Next, it's John Meyer. John? John?
Okay.
Have your
I'll
hand
go.
up? Go
I
ahead.
did because I am just talking about directly to the concept of Gateway National Recreation. Their
Yes.
website currently says that they are working in coordination with both the executive of New York and New Jersey, and they have limited access to facilities and things like that. So their buildings aren't open. Their restrooms are supposed to be closed. If people are there, that's another issue.
Okay, thank you. Next is Dimitro. Dimitro? Hello?
Yes, I
Dimitro?
was on mute. So going back to the display where it spoke about symptoms and then when you should be able to go out and so forth, did it cover how long you are contagious for during that period? So if you're symptom-free for 5 days, is the city Department of Health saying, okay, you're also not contagious and you can go about your business? I didn't understand that page.
Okay.
completely.
So Che, are you there and can you answer that question?
Yeah. So so the criteria is that it has been at least 7 days after your symptoms started. You have not had a fever for the prior 3 days without the use of fever-reducing drugs, and your overall condition has improved. So the 7 days, it's taking into account the probable incubation period. So the incubation period is between 2 to 14 days. And once the incubation period is set, then your symptoms start. So that's why we're saying at least 7 days.
Thank you. Next is
Vinny,
Laura.
I'm sorry, Vinny, I just want clarity on this. Are you saying that you're not contagious 7 days after being symptom-free? Is that what you're saying?
Yeah, for the most part, yes.
Okay, Laura, you're next.
Hi, I'm going off topic a little bit here. I just want to remind you that when somebody is phoned in, they can't raise their hand. So you'll see the phone and maybe we need to just open it up to let people who phoned in speak.
Thank you. I appreciate that. Fred Heffley, you're next. Fred? Hello, Fred, you had your hand up.
Yes, I'm here. Can you hear me?
Yeah.
Okay. The question is, the governor issued the state of emergency. Is he the only one that can lift that state of emergency? And is there a time limit that he is given by the state or the constitutional bylaws?
My opinion, I don't know if Che could answer, but my opinion is the governor issues a state of emergency for a certain period of time, and the legislature could counteract it at any time they want to, or extend it anytime they want to. Does anyone else know the answer?
So right now, there's Executive Order number 202, declaring a disaster emergency in the state of New York. The order is in effect until September 7th of this year. And on Monday, he signed the executive order granting him permission to extend it. So technically, the state of emergency order is in effect until September.
So I don't want to speak for Fred, but it almost sounds like a possibility of unconstitutionality, but that's for other people to decide. Go ahead, Fred.
Ride it, but we'll see what he says this week or next week.
Okay. Paul Kersey, you're next. On the subject.
Unmute, Paul.
I did. I got him.
All right. On that issue, as long as the governor issues a proclamation that is within reason. However, if enough members of both houses of the state legislature would like to overrule him, they could, but they'd have to pass they both have to first pass it individually by clear majorities in both houses, the Senate and the state Senate and the Assembly, and then he would have to veto that or ignore it. And they've got 14 days to act after that. And if they act to overrule him, and they have to overrule him with a 3/4 majority on both houses. And if they do that, then whatever the order was will be extinguished.
Okay. So thank you. We're running behind schedule. So I think everybody should be present. Laura, you want to call a roll call?
He's 80. My dad would be 87, so for 7 years.
Okay.
Involved in the Catholic Church.
Ladies, stop talking. Go ahead, Laura.
Okay, Vincent Arcuri,
Present.
Antonetta Biananti,
Present.
Robert Chimelli,
Present.
Walter Clayton,
Present.
Patricia Crowley,
Present.
Brian Dooley,
Present.
Jerome Drake, okay, Dimitro Fitkowski,
Present.
Steve Fiedler, Pat Grayson, okay, Fred Haller,
Present.
Fred Hofferly,
Present.
Rich Huber,
Present, and I have my computer also logged on. That's why I'm here twice. Thank you.
okay, Paul Kersner,
Present.
Marianne Latanzio,
Present.
Ed Littell,
Present.
Mike Leando. Okay, John Meyer,
Here.
Patricia Maltesas,
Present.
okay, Edgar Mantell,
Present on the phone.
okay, and Kathy Massey,
Present.
Eileen Maloney. Margaret O'Kane,
Present.
Michael O'Kane,
Present.
Don Passantino,
Present.
Michael Pacelli, Kenneth Redberger.
Present on phone.
Okay, thank you. Ted Renz.
Present on the phone.
Okay, Calvin Rodriguez. Luis Rodriguez. Lee Rottenberg.
Present.
Walter Sanchez. Connie, Dennis Steffen.
Yeah. No, you missed Carmen Santana.
Carmen's not here. She said she wasn't attending. Dennis Steffen.
Yeah. What do we hear from? Slow down, Connie.
Connie's no longer on the board. Catherine Sumsky.
Wait. Slow down. The borough president, because of the current situation, extended everybody through the rest of the year.
Okay, but she resigned.
Yeah, but theoretically, she's still on the board, so she's not here.
Sorry, Kathy Sumsky.
Hold on.
I'm here. Phone.
Dennis.
Okay. I said Dennis and he replied. Megan Taddeo. Guyanel Thapa.
Present.
Barbara Toscano.
Present.
Patrick Trincasi.
Present.
Nicolene Von Draven.
Present.
Crystal Wolf. Mariana Zero.
Present on phone.
And Nan Zhang.
Present on the phone.
Okay, and we have Gary Giordano.
Present.
Is Catherine O'Leary there?
No, she
Okay.
said she was ill.
Oh, okay. And we have Che. And is Joe Nocerino here?
Yes, I'm here.
Okay, Joe, great. Okay, thank you.
Very good. Thank you very much. So let me get my program here, or my agenda. Gary, would you like to do the public forum comments, please?
Okay. Can you hear me?
We hear you loud and clear.
All right. Okay. We got some information sent over by the Census Bureau, some local representatives, which is not good news as far as returns go, or the rate of return. So nationally, the rate of return is 58.6%. New York State's only 53%. Queens is only 47%. Ridgewood is 43, Maspeth's 47.49, Middle Village is 46.57, and Glendale is also 43%. So it says here that in light of the COVID-19 outbreak, the U.S. Census Bureau has adjusted 2020 census operations in order to protect the health and safety of the American public and census employees. So the self-response phase is being extended from July 31st until October the 31st in the new schedule. I don't know how well census takers are going to be able to try to interview people, households, at their household, but that would also be until the 31st of October. But instead of starting in April, they're not going to start until August 11th, going door to door. So at least we have some more time, but the returns so far are pretty dismal. And as I think you all well know, federal funding and federal representation is dependent upon census results.
So the good part is that the commercials on, everybody's sitting home watching TV, and those commercials that are saying, fill out your census, is helping, I think.
Okay, so that's the census issue. So that's number one as far as the public forum goes.
Right.
Second thing we got was a message from Maspeth High School.
Okay.
We got this from Mario Matos Jr., who's their community liaison. And it says, we hope when you hear this message, you, your families, and your loved ones are safe, healthy, and most importantly, home. First, since March 23rd, 2020, our school, Maspeth High School, community has been actively engaged in remote learning using the Google Classroom platform. Students engage with classroom teachers on a daily basis. Departments actively collaborate virtually, and administration continuously provides support and guidance in all educational matters. In addition to the daily updates and announcements provided by faculty and support staff, Maspeth High School's guidance department continues to actively reach out to families in order to assist families in obtaining a Department of Education issued iPad should they need one, ensure students are actively engaged in remote learning daily, and be available to support students and families with emotional and academic concerns. Remote learning will continue for the remainder of the school year. We hope to receive guidance in the coming weeks as to a return to on-site instruction, alternative prom and commencement exercises. Lastly, it's official, Maspeth High School is a 2020 best high school based on rankings that U.S. News and World Report published April 21st. Our students, parents, support staff, faculty, and administration are proud of this achievement. One final note, the COVID-19 pandemic has affected Queens at the heart of where many of our school families reside. Our school community, meaning Maspeth High School's community, extend its utmost gratitude and appreciation to all the essential workers providing sorely needed services during this crisis. And then they said one could visit their website at www.mhs.nyc for news and updates. From Mario Matos.
Good. Thank you. What else? Anything else?
One other one. We got something through our webmail regarding 6058 68th Road, where the property owner is talking about a landmark issue, and he says that he recently did a solar installation, and the Landmark Commission said that to get final approval of an electrical conduit that is in front of his house, we would need to get something from the community board.
It's in a historic district. All right. Why don't we turn that over to Walter for land use, and if he wants to consult with Paul Kersner and see what they want to say about that.
Okay.
Thank you. Okay. So I have a report from Officer Berish from the 104. The statistics for the last 28 days. There was 1 rape, 3 robberies. Excuse me. Felony assault is up by 5. Burglaries are up by 11. Grand larceny 13. Grand larceny auto 3. The big problem is because of all the stores being closed and the bars being closed, the grand larceny and the burglary is up. Also, the felony assault is up because of everybody being home. Most of it is domestic abuse. So we got to get through this thing. You know, and that's a problem. But statistics are up and basically related to everybody being home because of the coronavirus and the stores being closed. Okay.
You have a hand up, Vinny?
I'm sorry?
You have a hand up?
Yes. Mookie. Peg. Speak. Peg. Speak. Peg.
You're muted.
Yeah, the mobile command post has been parked at Myrtle and Fresh Pond for several weeks. Does Barish indicate why?
Because of the break-ins in the stores, the bars, and restaurants.
Yeah, well, the break-in was while they were parked there, because I spoke to Laura Arcuri today, and she said the break-in at the Chinese restaurant on the next block was while the mobile command post was parked there.
But that's a great source of information that you should take with a tongue-in-cheek. Besides that, that's why they're there, because that's where the crimes are occurring, and that's where they move the mobile unit to.
Well, it's been there quite a while now.
Okay, thank you. So the next item of business is the chairperson's report, and that's me, whether you like it or not. Gary, you want to read the statements from the elected officials, please?
Okay.
You have them, or you want me?
I got them.
Okay, good. Thank you.
Well, Vinny, if you don't mind, start with Joe Nocerino. He could read the BPs.
Oh, okay. Yeah, I forgot. He's still part of staff. So, Joe, under his staff reports, what do you have for us?
Hello, everyone. And Vinny, if I'm staff, I haven't seen a paycheck in a while, but thank you.
Yeah, you ain't getting one either.
Anyway, I hope everyone's well. Most importantly, Borough President Lee sends her regards and well wishes. Just to start with, I want to bring up that their tail onto Vinny with domestic violence. Our District Attorney, Melinda Katz, partnering with Sharon Lee, but it is the District Attorney's Town Hall on domestic violence tomorrow, May 14th, from 11 a.m. to 12:30 p.m. And you can watch that if you go on to the Borough President's website. So just to agree with what Vinny said about that, and it's important that we know that's there and that the district attorney is on it. Census. Gary sent around a sheet for me, so you guys can read it, but I'm just going to touch on a couple of things. Census, please. Yes, the numbers, as Gary said, are low. Let's www.my2020census.gov. Let's push folks to do that. Borough President Lee, community board appointments will be made at the end of May. And then just some notes around town. IKEA and the borough president's office have donated thousands of items to folks in need, new bedding, towels, toys. That's one program that she has been doing. She's also worked with Coca-Cola and automobile dealers to distribute PPE around the borough and to hospitals. Fresh Direct continues the food donations to the different community board centers around, is continuing through July. And Fuel the Front Lines has been extended to a total of 2 months, which is feeding hospitals and first responders. And that's with Queens Night Market and the Economic Development. I touched on these items. If you please look at the sheet that Gary sent around to all of you. And then, of course, the town hall. And I thank you all for your service and your time, and be well and safe. Thank you.
Who's winning the wrestling match?
Yeah, I noticed that was on in the background. One of my sons must have flipped that on. That's not me.
Okay, Gary. Thank you.
And thank you, Vin, for pointing that out.
You're welcome.
Okay, so we did get a statement from Congresswoman Nydia Velázquez. She's announcing $99 million in aid for local hospitals. And the resources being dispersed by the U.S. Department of Health and Human Services is targeted to hospitals with high rates of COVID-19 infections and hospitalizations. The two local hospital groups, New York City Health and Hospitals Woodhull and Wyckoff Heights Medical Center, will receive aggregate of $99,779,000 to directly combat the COVID-19 pandemic. She's saying New York City has been the epicenter of this pandemic, that the healthcare workers are performing heroically to provide patients with quality treatment, but hospitals are struggling against unprecedented surges in patients and demand for care. These targeted grants appropriated under the CARES Act focus on specific hotspots of activity, servicing the areas that need it most. She says she's pleased to see these funds allocated for the hospitals to supply our doctors, nurses, and other healthcare professionals with the tools that they need. And the two hospitals in New York's 7th Congressional District, which Nydia Velázquez represents, New York City Health and Hospitals Woodhull will receive $39,901,000 for their programs serving Bushwick, Williamsburg, Greenpoint, Bedford-Stuyvesant, and Fort Greene. And Wyckoff Heights Medical Center will receive $878,000. The medical center serves northern Brooklyn and western Queens. She's saying one painful lesson from this pandemic will undoubtedly be that our healthcare and public health infrastructure have been chronically underfunded for far too long. These funds will help to meet the immediate needs of the current crisis, but for the long term, we must also look to strengthen and adequately invest in our healthcare system. So that's from Nydia Velázquez, the Congresswoman. This one's from Grace Meng. It's a brief statement. And it's Congresswoman Meng and staff sincerely hope that all CV5 members remain healthy and well. We would like to remind you that our office is available to you for any questions or inquiries you may have during this time. Please give us a call at 358-6364 or email us at ny06casework@mail.house.gov. And that is from Congresswoman Grace Meng. Councilmember Robert Holden staff sent a statement. The councilman is saying, hello, neighbors, Community Board 5 members, and fellow elected officials. I hope that you are all staying safe and healthy, and I thank you for your continued work and volunteerism as we navigate this unprecedented crisis together. Even though our efforts to slow the spread of COVID-19 have been effective so far, it is important that we all continue to practice social distancing, wear masks in public, and practice good hygiene so that we can all see each other again as soon as possible. Councilman Holden is saying that his office in Middle Village remains closed, but my staff and I gladly continue to serve our constituents every day while working from home. Please do not hesitate to call 718-366-3900 or email district30@council.nyc.gov, their office, anytime when you need assistance. Over the past month, the City Council has been working hard to conduct its business as usual given the circumstances. We made history by conducting the first ever virtual stated meeting via Zoom to vote on legislation related to the city's coronavirus response. We are also conducting virtual committee meetings every week as we deliberate over Mayor de Blasio's proposed budget for fiscal year 2021. During a recent Transportation Committee hearing, Councilman Holden is saying that he urged the Department of Transportation's Commissioner Polly Trottenberg to work with local communities in developing a plan to close streets around the city to give pedestrians more safe space for recreation. In the following days, we worked together to pinpoint 3 roads within Forest Park that could safely close without adversely affecting the surrounding communities. I have also continued to send letters to Governor Cuomo with suggestions for how the state can aid the city during the crisis. Most notably, 3 of his colleagues and he urged the governor to enact temporary subway closures for regular cleaning of trains and stations and to help homeless individuals move from the trains and into a safer location for everyone. 2 weeks later, the governor announced the overnight closure of the subways between 1 a.m. and 5 a.m. while providing free rides to essential workers during those hours. In addition, Councilman Holden says that he called on the governor to rescind a Department of Health directive that forced nursing homes to care for COVID-19 patients, and he ultimately did just that. Going forward, the councilman is saying, I am calling on the governor and the mayor to create localized task forces to determine which businesses can begin to reopen in our communities with social distancing guidelines. Our small businesses have suffered greatly over the past 2 months, and we must be fully prepared to restart our economy as soon as it is safe to do so. Thank you again for your dedication to our communities, especially during this time. I look forward to seeing all of you again soon. So that's from Council Member Robert Holden. Next statements from State Senator Joseph Addabbo. Says, I hope this email finds all at CB5 well. On behalf of my team and I, please relay this message to the board members tonight. My team and I hope all at CB5 are well and staying safe. Please know that my Middle Village office has remained open during the coronavirus pandemic, Monday through Friday, 10 a.m. to 2 p.m., and can be reached at 718-497-1630. Thereafter, a 24-hour live operator service is available. My team and I have been addressing virus-related matters such as unemployment benefits, claims, and food services, in addition to the usual community and quality of life issues. Please let us know if we can be of any assistance, hoping all remain safe as together we'll get through this pandemic. That's from Senator Joe Addabbo. Now we have a statement from Assembly Member Kathy Nolan. It's a short statement. It says here, thank you to the district manager and the Community Board 5 staff for organizing this remote meeting and continuing your work for our community, and to the chair and board members for their dedication during this time. I know that many of my constituents are facing difficulty with their unemployment applications. Many have contacted my office. I encourage anyone who is having trouble, who has not yet reached out to my office, to do so by emailing me at nolanc@nyassembly.gov or by calling her district office at 718-784-3194. And she says that she will continue to advocate on our behalf to the Department of Labor. I hope everyone stays well, and thank you again for your participation here tonight. Then we got a statement from Assembly Member Miller, which is also not too lengthy. And it says that their office is refilling hand sanitizer bottles between 9:30 a.m. to 4:30 p.m. Monday through Friday. Our staff is rotating, working in the office Monday through Friday from 9 a.m. to 5 p.m. When not working in the office, staff is working remotely. People can email Mike Miller directly at millermg@nyassembly.gov or call the office at 718-805-0950 with any problems. When staff isn't in the office, the phone bounces directly to Assemblyman Miller, and they're hoping that everyone stays safe. Then we got something from Assemblyman or Assemblymember Brian Barnwell. It's from his, I guess, Chief of Staff, Victoria Leahy. I am writing to submit our office statement for tomorrow's board meeting. Our office has created a COVID-19 community resource guide, which includes information and resources for individuals impacted by COVID-19 that are offered by the city, state, and federal government, as well as nonprofits. We've shared the resource guide with CB5 and will continue to share the guide with the public. Our office was able to restock the food pantries run by St. Jacobus in Woodside and Cornerstone Church in Elmhurst. If you know of any other pantries that need some donations, please contact our office, meaning Assemblymember Barnwell. We would like to thank Mass with Federal Savings for their generous partnership. With their help, we were able to secure 11,000 masks for hospitals and emergency workers. Lastly, if you have any questions or concerns, please do not hesitate to call our office. We are continuing to work remotely and are more than happy to help. We can be reached at 718-651-3185. If you are not able to get through to us, please leave your name, number, and a brief message describing your issue. We'll call you right back. Thank you and be well, from the office of Assemblymember Barnwell. And then last but not least, Assemblymember Andy Hevesy. He says that he hopes everyone is doing well. Thank you to CB5 for continuing to serve as a resource and leader under these conditions. As many of you may know, we are seeing a spike of unemployment claims that remain pending or incomplete even weeks or months after the initial filing date. People experiencing this problem can reach out to our office. We have been forwarding cases to our contact at Department of Labor and are working to resolve a number of these cases. With May being Mental Health Awareness Month, Assemblyman Hevesy is saying he is also providing a list of resources that can help with stress, anxiety, and other forms of emotional distress, which are being exacerbated in the pandemic. If there are any other concerns with general resources or the state response to COVID-19 or any other problem for that matter, please call us at 718-263-5595. And he says, thanks again and stay safe and well. Support may be found by calling the New York State Emotional Health Support Line at 1-844-863-9314, the National Suicide Prevention Line at 1-800-273-8255, or by texting got5 to the crisis text line at 741-741. And that is all the statements we got from our very active elected officials, Mr. Vinnie.
Thank you, Mr. Giordano. So, board members, you should have received the minutes of the last meeting electronically. Do I have a motion to accept, or?
Make a motion to accept the meeting as read.
Who's that?
Walter Clayton.
Walter, do I have a second?
Mariana Zero, second.
Mariana, thank you. All in favor?
Aye.
Any opposed? Any abstentions? Okay, so I have liquor, wine, and beer license application. No new liquor licenses reported. License renewal, California Pizza Kitchen, 8,000 Cooper Avenue, Building 7, Glendale, New York. New wine and or beer license, Chipotle Mexican Grill of Colorado, LLC, 5902 Maurice Avenue, Maspeth. Wine or beer license renewals, Sal Fresh, 6810 Fresh Pond Road, Ridgeway. Okay, what else? I think there's no building demolition notices. So the next item of business is Mr. Giordano's report.
Okay.
Anything, Gary?
Yes, a few things. First is, I think you all know, the city is now going to put organics in with the regular garbage for budgetary reasons.
And also,
so hopefully that won't go on forever.
Alternate site is suspended this week too, next week.
Well, there you go. I think we're looking, as I think a lot of you know, but we need to be prepared for it, for significant budget problems at both the state and the city level. I know the numbers for the city keep going up more and more. I mean, at one point it was $6 billion projected deficit, and then it went up to 7.4, and now I think it's beyond that.
13.5.
Say that again?
13.5.
Yeah. It's getting worse and worse. So the economic impact from all of this has been extreme, to say the least. Once again, many thanks to all the healthcare workers, especially the nurses, and the EMTs and the firefighters and the police officers and all those food service workers who are making sure we get fed, and the grocery store staff and the postal workers and the MTA crews and all the others that have been out there doing the best they can under all these really difficult circumstances. On a more everyday level, the Penelope Avenue, 74th Street area sewer project, as I think you all know, all the water main is in, the sewer line is now completed, and they're doing resurfacing work. So I saw them setting up to resurface 74th Street between Penelope and Juniper Valley Road. They were all set up today. How much of it they did, I don't know. They had a beautiful day to do it. So hopefully that'll be over real soon. The Calamus Avenue, 70th Street area, enormous sewer project is moving very, very well. I haven't heard anything about the project that is going to go from 71st Street, Lutheran Avenue, area there on the west side of Juniper under the railroad tracks, down Our Lady of Hope's block or up Our Lady of Hope's block, up Dennis Steffens block going to the highway. I don't know if that sewer project is, in trouble because of budget reasons. And then there's a big water main project in the Troutman Street area in Ridgewood that is ongoing right now. And I think they're going to open up the trunk main in Troutman Street very soon. And then on the Parks Committee level, we got revised schematic drawings that we're going to have to look at for Star Playground. On a coronavirus front, I think some of the good news is that from what I've seen, the number of cases have gone down dramatically, at least since the 8th. That's not a very long time. But as I said before, just as an example of how things got so crazy, on St. Patty's Day in New York City, there were 2,400 reported cases that day. By April the 6th, it was 6,348 cases reported, more than 2.5 times what was reported just a few weeks earlier. And May 8th, that was down to 1,040, or 1/6 of what it was on April the 6th. And the most recent date I had is May 11th, and it was 586 cases reported. So far in New York City, 185,206 cases reported. 49,307 people have been hospitalized. They say the deaths confirmed are 15,233, and the deaths probable are another 5,083. And the terrible situation that has been the case with the nursing homes. And that is my report, sir.
Thank you. Thank you very much, Mr. J.
Vinny, Kathy has her hand up.
Go ahead, Kathy Massey.
Yes, Vinny, I wanted to see if Gary could report on the CAB meeting that we had.
The who?
The advisory board.
The what?
Community Advisory Board.
Okay.
Will be at Cooper Avenue Shelter.
The Shelter Community Advisor. Okay, Gary?
Yeah, I don't know if it was really a community advisory board meeting, but it was like the first step at getting to that. And I think a lot of the concerns that were raised, especially by Kathy Massey, were whether or not what they call the homeless shelter clients there and the staff had proper protection, especially face masks. And I think there were some questions as to whether or not everybody there or near everybody there had that proper protection. And I know that Kathy did a good job at trying to hook them up with a couple of local pharmacies who she knew had some masks. Because the last thing that one wants is people getting infected and then people going out into the community and possibly infecting other people. And there was some discussion with regard to some of the incidences that may have happened at the shelter. Obviously, that stabbing incident early on was one of them. And then there were 1 or 2 other instances that may not have been caused by any shelter residents that were discussed.
Yeah.
But Kathy might want to elaborate more. I thought it was a good first meeting, quite reasonably cordial considering the circumstances.
Well, I appreciate, Gary, that you didn't consider it an official CAB meeting, because I felt the same way. Because we had absolutely no input. Actually, I had to push myself onto the CAB committee. DHS picked people, and they decided that they were having a CAB meeting. And I mean, it was relatively civil, and we did try to work with them in a reasonable way. We really didn't make any progress, though, because at this point, we've hooked them up with all the proper people, and they really didn't do anything about protection. And they have too many, as Vinny knows, people in. It's not possible for them to social distance in the building. They have 120 men in there in addition to staff. So we're closer to 140 people in that building. And you can't possibly have 120 men sleeping 6 feet apart. And I don't think they're going to do anything to correct it right now. And it was brought up that they are trying to move people into hotels. But that's not the case for this particular shelter. Moving homeless out of shelters and into hotels is only for seniors and not for a working employment shelters. So they're never going to move those people into shelters, and it's only going to get more. I think in subsequent emails and conversations, we have them holding at the 120. And if anybody ages out,
come on, Don.
Which it should be like a 45-day time frame, which would give them by our next CAB meeting, then there should be basically less than 50 people there. So that'll tell us if they're actually it's a 45-day stay.
They can't house them in congregate living under these conditions. And there was only a temporary C of O for 45 days. And I think it's basically past the 45-day period. So we need to.
The temporary CO expired yesterday and was extended another 45 days.
Okay, so when I listen to Banks and the mayor every morning, because I'm addicted to stupidity, he keeps talking about separating, getting the people out of the shelters, getting them into hotels. So I think somehow we have to address this with the mayor's office, and we'll work on that probably this week. All right?
Okay.
Thank you. Richie, you had something to say.
Yes, hello, everybody. Richie Huber, member of this board, regarding Gary's report about the budgetary issues. Prior to this entire COVID issue, we went into this with $6 billion in the hole. Ironically, a couple of years ago, New York State budget did have a surplus, and Senator Dabo was looking at what do we do with this excess surplus? And I said the wise and prudent thing would be to put it into a rainy day fund. Here we are. With a $6 billion shortfall, and Senator Dabo was talking, how can we fix this prior again to the COVID? And his theory was to do legalized sports gambling. Could you imagine with everyone right now being home with nothing to do, online, no income, and doing online sports gambling? Who knows now where pro sports will even be in a year or 2 years. So I find it ironic. The only way that this legislature I see fixing it is with absurd taxes. Every year we lose people moving out of this state due to the tax policy. And people are going to be running out of here like rats from a sinking ship, as I have said before. And it's sad this state will be a self-fulfilling prophecy, especially when people are learning now that they don't have to go to work in Manhattan anymore, and that they can work off-site from anywhere they want. And I think our elected officials are going to have to look at all of their policies that will bring us to this. Regarding the census, it will not fare us well, and maybe we will lose 2 congressional seats this time. Thank you very much for your time. Everyone, please stay safe.
Walter Clayton, you're next. Walter.
Okay, all right, you hear me now?
Yeah.
Okay, Gary, you mentioned that they're starting to pave 74th Street between Penelope and Juniper. what about Penelope itself? That's been a disaster for years now. Are they going to start paving Penelope?
Well, they've already put down 2 3-inch layers of asphalt there, and they have to put the top layer, which I think is a 2-inch layer. So they've done that work. Yeah, Penelope is a lot better.
It's a lot better. Okay, I obviously haven't been out much. So. All right, it's good to know. Good to know, because that's been very bumpy on that side. Thank you.
Thank you. Paul Kurzner. Paul Kurzner. Speak.
I'm with you. Okay, thank you. Gary, going back to the Cooper Avenue shelter, at this point, can or not the gentlemen who were staying there, can they stay outdoors during the day, or can they stay in as the mayor has asked everybody else to do?
No, they're out on the street, Paul. I'll tell you that. Kathy could tell you that. They are, and they have not provided them with the bus service to take them to the subway station as they promised.
And they're supposed to be all looking for a job, right?
I'm sorry?
They were all supposed to be looking for a job.
Well, they leave the shelter, walk up to the corner, get the bus to go to the subway, whichever direction they're going, if they're looking for a job, or they just roam the streets.
All right. It seems to me that next time you guys have a conversation, or maybe send a letter immediately to the commissioner, and let him know that they're counteracting their boss's position on people staying in during this pandemic.
Correct. Kathy Massey, you addressed that? Kathy? Did I lose you?
Can you hear me now, Vinny?
Now, yeah. Okay.
Yeah, they're not staying in, they're congregating, and the issue of them going to their employment, the response to that is most people have lost their jobs, including anyone that's in the shelter that did have a job. So there is no work out there. So you basically have 120 men congregating all along. Since the cab meeting, they have been staying behind the fence, but it's still in close proximity to each other. They're not sick. They're not social distancing among themselves at all.
All right. Hey, Mark Moss, so I think someone was trying to call in. Can you figure out who's calling?
I have nobody on the waiting list.
I saw it. I saw the symbol for a phone call. All right. Thank you.
No, that's Ted and Fred Howler on the phones.
Okay. So if there's nothing else on this.
Paul has his hand up again.
Go ahead, Paul. Paul?
Paul, you have to unmute yourself.
All right. Is there any way to have the health department check, or whoever the agency that's checking out on the number of people who have or who are carriers of the virus? Is there any way for them to check outside of the Cooper Avenue location to see how many of those gentlemen are carriers of the disease?
I would strongly recommend, because you're very close to the state local officials, that they set up a test site right there, because the state has a test site at Aqueduct. They have a test site elsewhere. I think you're very close to Kathy Nolan, and I think you should ask her to talk to the governor and set up a test site at that location for the community.
I will do that. The question that I have is, who is the assembly person for over there? Is it Kathy Nolan?
I'm not sure. It's a strange borderline. I'm not sure.
I believe it's Andy Hevesy.
Yeah.
I believe it's Andy Hevesy.
They moved the lines. It's either Andy or Mike Miller, yeah.
I'll find out and I'll follow up.
All right, thank you. Okay, anything else, or we'll go to committee?
Richard, you have Richard?
Who? Rich, yeah.
Two things. Number one, that is, I can say with good certitude, Assemblyman Hevesey's district. Number two, with regard to testing the people in the homeless shelter and releasing the information of who's infected and who may have it or who may not, that is a direct violation of our HIPAA laws and privacy and such. So we will never get that information. That place is totally overrun, and we have no right to that information. Thank you very much.
Very correct, Rich. But let's see what we can do. All right, can we go to committee reports now? Do I have transportation? John? Or Ted?
Hello, Vinny. I can do a quick report. We met at the end of the month across a WebEx webinar, and we met for about 2 hours, talked about both the ongoing bus route replanning and wanting to reach out to the MTA to ask them to look at combining both Queens and Brooklyn. As we've indicated to them, they are so intertwined. They should be really kind of thought of together, especially for our board. There was quite a bit of back and forth. There's so much unknown about what is happening with the budget of the MTA at this point. New Jersey Transit, all the transit agencies in the tri-state area are suffering at this point because there is no revenue coming in, and the state budgets are all getting hit with so much COVID response. We discussed that a little bit. One of the big things that is moving forward to some degree is a meeting with the folks of Amazon to talk about the facility at the Metro Mall. That will hopefully get put in place soon so we can have a follow-up with them. We do not at this moment have a scheduled meeting for the next transportation committee. So,
thank you, John.
Yeah.
Anybody else on committees? Paul Kersner, we're going to send you, not Paul, I'm sorry, Walter Sanchez. We're going to send you some correspondence in regard to the historic district. There's a question on a specific building there. You may want to involve Kersner with it. It's a guy that's doing a solar panels on the roof, and he basically wants to run the conduit down the front of the building.
Yeah, I got the request from Michael Park, and it's on 6058 60th Road, 68th Road, it looks like. And basically, he got a buildings department permit to put solar panels on his roof. I don't know how he got that, but maybe they do that. And now the Landmarks Commission said he had to come to us to get some kind of approval on putting, the conduit in front of the house and putting the electrical box that he says everybody in the neighborhood has in front of his house. Again, I've said this before. We don't want to be the ones to say yes or no to anybody, because then we'll get a flood of requests. So, we'll talk about it.
I suggest you talk with, involve Kersner, because he did his building in that area. Kersner has the solar panels on his roof, and see how he did it, and maybe they could do it, you could speak with them. All right?
All right, I'll get the committee involved. I really still don't want to be their dumping ground, Landmarks.
No, I understand, but it's something that coordinating with the community and that, all right? Since we do have experience on it.
You got it.
Any other? Hello?
Paul has his hand up.
Go ahead, Paul.
I just wanted to respond to Walter's concerns. There is a way to, having done this on 3 of my buildings, there is a way to get approval from landmarks very simply having the, and meeting the requirements of the installer, the solar installer, by running the conduit down the back wall.
All right, so you guys get together and resolve it, please.
I have a question, Paul. Why didn't they ask you to come to the board? How come they asked other people? How come they asked this guy to come to the board?
I don't know.
Why didn't they ask you to come to the board and to get approval?
Paul did his before it was a landmarked area.
No. He's talking about the Ridgewood property owners. You know, because most people don't know we exist or our committees or community organizations exist. You got new people moving into the area, Walter, and they just come in and do whatever they want to do.
No, well, my question is
why
that's not Walter's question.
Threw him to us, and I'm asking why Landmark didn't throw Paul to us. You did it before Landmarks got involved?
Normally, no. Normally, Landmarks does give me a call, and I'm surprised they didn't this time.
All right. So
no, Paul, I think the actual question that Walter is asking is when you did your installation, why didn't you have to come and because you weren't looking to do anything that was outside of the landmarking. You did it right for what? Your first installation was way before your area was landmarked.
Yes.
Yeah, but he also did it the right way. So there was a question.
The next two that I did were after the designation, and I had no problems.
Yeah, but Landmarks can't send it to us if somebody does it the wrong way.
Well,
just say no.
When we talk to them, we'll straighten that out.
Okay. You guys get together and do that. Any other committees?
Walter, call me tomorrow.
All right. If there's no other committees, we have nominations for executive committee positions. Mr. Giordano, would you go through that, please?
Okay. So we start with chairperson. The executive committee is comprised of the chairperson, that's Vincent Arcuri. First vice chair is Walter Sanchez. Second vice chair is Dimitro Fedkowski. The treasurer is Kathy Massey. The secretary is Margaret. We know her as Peggy O'Kane. Happy birthday, Peggy. I know today's your birthday.
21 again, huh?
God bless. And there are 4 members at large. So they are Ted Renz, Pat Grayson, John Meyer, and Paul Kersner. The goal is to have at least one member of the executive committee, which we have now, that is a resident of at least one of the 4 major neighborhoods that we cover, those being Ridgewood, Maspeth, Middle Village, and Glendale. So we'll start with nominations for chairperson.
Hold on, Gary. Laura has her hand up.
Okay.
Hold on. Gary, I have Pat Grayson here who has a question. Go ahead, Pat.
Thank you. My question is since we've been extended to the end of the year or the end of our term.
Pat, slow down, Pat. We'll get to that after we do nominations.
No, I want to know why before we do the nominations. Are we able, if we wanted to hold off and let more of the board be represented? Because from what I heard, they're not overflowing with 50 people anywhere.
Okay, so let me answer the question. As of 5 o'clock tonight, there is no answer to our questions. No one in the mayor's office or in Borough Hall even thought about that there would be a problem with voting next month. So we asked the question today, if the city reopens, we still probably will not have a face-to-face meeting in June. We will probably still have to be online. So the question is the legality of voting online. The precedence for voting remotely is absentee ballots. Everyone knows you could vote absentee ballot. They're talking about doing that for the Democratic primary and everything else. So as soon as we find out if they can, if the city makes a decision, we'll follow that. If they don't make a decision, we will consider producing an absentee ballot, so to speak, to all the board members that will be mailed out before the June meeting and would have to be postmarked the day after the June meeting, and then we will produce those results in July. But right now it's up in the air, but we still need to, this month, do nominations.
Oh, just one last question. You answered my question. Thank you.
You're welcome.
This is above and beyond that, but it's about this. What if there's somebody sitting out there, I don't know, whatever they're doing?
I'm sorry? Laura, could you repeat her question? Hello? We lost her. Laura, could you repeat her question? No? All right. Lost that question. So everybody understands we're still taking nominations today, and we don't know how we're going to vote next month. All right? So go ahead, Gary.
Okay. Vincent Arcuri is the current chairperson of Community Board 5. Are there any nominations for the position of chairperson?
Yeah, it's Walter Clayton. I'd like to nominate Vinnie Arcuri for chairperson.
Mr. Arcuri, do you accept?
Yes.
Okay, thank you. Any other nominations for the position of chairperson?
Paul?
Walter was recognized before I wanted to do the same thing.
You were going to nominate Vinnie?
That's why you have to click raise your hand.
Okay. All right, so the nominee is Mr. Arcuri. There'll be other nominations allowed at the June meeting.
Somehow we'll do that before either electronically or by paper. Yes, thank you.
Any other nominations for chairperson? Okay.
Hold on. We have a hand.
Does he accept? He's got to accept.
You did.
Yes, he did.
Yes, I did, honey. Thank you.
Don't call me honey, baby. You're younger than I am.
Well, it is your birthday, Greg.
Happy birthday.
All right, so first vice chairperson. The current first vice chairperson of Community Board 5 is Walter Sanchez. Are there any nominations for first vice chair?
Demetro had his hand up first.
I nominate Walter Sanchez.
Walter, do you accept?
Yes.
Okay.
Marianne has her hand up.
Marianne?
Nope, I was going to nominate Walter, but I was too late.
Are there any other nominations? Thank you. Are there any other nominations for the position of first vice chair?
I missed it.
Going once, going twice. Okay. Second vice chair is currently Dmytro Fedkowski. Are there any nominations for second vice chair?
John has his hand up.
I'd like to nominate Dmytro Fedkowski for second vice chair.
Dmytro, do you accept?
I do.
Okay, thank you. Are there any other nominations for second vice chair? Going once, going twice? Okay. For treasurer, the current treasurer is Kathy Massey. And are there any nominations for the position of treasurer?
Walter Sanchez has his hand up.
Yeah, with pleasure. I'd like to nominate Kathy Massey for treasurer.
Okay. Kathy?
Can't hear. What's that?
Yeah, let me find her. She's not on the list.
I don't see her.
I don't see her.
You coming back? Where are you?
Oh, I'm back in.
I don't see Kathy Massey anymore.
You were nominated. You back in?
Let's assume she said yes.
Okay. So let's move on for now, if you don't mind. Any other nominations for the position of treasurer? Going once, twice? Okay. Secretary. Peggy O'Kane is the Secretary of Community Board 5. Are there any nominations for the position of secretary?
Fred had his hand up.
Yes, I nominate Margaret Peggy O'Kane.
Peggy, do you accept?
Can't hear her, Laura.
I'll unmute. I accept if I'm reappointed. Thank you.
Okay.
God willing, yes. Are there any other nominations for the position of secretary? Going once, going twice? Okay, no other nominations. Okay, for at-large, the current at-large members of the executive committee are Ted Renz, Pat Grayson, John Meyer, and Paul Kersner. Are there any nominations for members at large?
Peggy has her hand up.
I'd like to nominate John Meyer.
I accept.
John, do you accept?
Yep.
John also has his hand up.
I would like to nominate Ted Renz.
Ted, do you accept?
Yes.
Demetro has his hand up.
I'd like to nominate Pat Grayson.
Pat, do you accept?
I have to unmute you. Yes, Pat says she accepts. Say it, Pat.
Paul has his hand up.
It was just done for me, thank you.
Fred has his hand up. Fred, you have to unmute.
Yes, I'd like to nominate Paul Kersner.
Paul, do you accept?
Yes.
Any other nominations for at-large?
This is Ted Renz. Hello?
Go ahead.
Yeah, I'd like to nominate Fred Howard.
Fred, do you accept?
Yes.
Are there any other nominations for at-large members? Going once, going twice? Okay, so we'll take this up again at our next board meeting.
Very
Thank
good.
you.
Thank you. Is
Hold
there
on
any?
1 second. Hold on 1 second. Ed had his hand up.
Yes, I wanted to, if Walter Clayton wanted to accept the nomination for member at large, I would nominate Walter Clayton.
I accept.
Okay. So if there are any other, if not, we'll close nominations till next month and we'll work on that. We'll figure out how to do that when we know what's going on. Okay. The next item of business is old business. Any old business we need to take care of? Any new business? Someone called me today and had new business.
I asked you about new business at the beginning of the meeting, Vinny. This is John. I just noticed in our agenda, we say we'll accept public comments. But with this new environment, and we're thinking that June might very much be like this, it's hard to know that when you just go to our website. If you don't really call into the office, you don't know that. Board 6 in Queens actually has a statement on the homepage of their website, which they use the Do It website template just like we do. They have a notice that says that people can submit comments beforehand.
All right, so
just to make it a little more public.
No, I think Laura will look into that. Thank you, because we've been kicking around how to reach people, and I'm sure she's happy to know that you have a suggestion. Very good, thank you.
Yep. Paul has his hand up.
Go ahead, Paul. Hello?
Paul, you have to unmute.
Can you hear me?
Now we can, yes.
Okay, good. This goes to the beginning part of this evening's meeting with reference to Rockaway Beach. And the question I was going to ask Gary is Jonathan still the district manager of Board 14?
Yes. Yeah.
Maybe you could talk to him and see what their guidelines are down there, and then just put it in the minutes so we see it for next month.
According to what, Paul?
Well, when you have a conversation with the district manager, that's the question. That's the first question you can ask him. According to who?
But I mean, what are you asking?
There was a concern earlier on about how to handle this issue of beach. And so I was going to ask, that this is going to be my second question, but my first question was to ask Gary to speak to Jonathan to see how they, in an official capacity, are handling this.
I think they're not handling it at all. They're waiting for the mayor to make a decision, as far as I know. And the mayor has been toying with the idea that is going on in Nassau and Suffolk, where the boardwalk may be opened to social distancing, or whatever that word is, and the beaches would be closed. As of today, the mayor's position was that all the beaches are closed.
Yeah, hi, Vin. It's Fred Haller. He was responding to my comment earlier in the meeting.
Go ahead.
So I didn't want to give the impression that I was not in favor of the beaches and the boardwalk being open. It was the behavior of the people. There was a survey from the Wave, which I responded to, and I said, look, boardwalk, concessions, beach should be open, and water for wading, but no swimming unless there's lifeguards. But people have to be cognizant that they have to keep apart. If you close all the parks and you close all the beaches and you close places where people can be, they just have to congregate together. So you have to open up. You have to open up spaces. Okay, so if all the parks are closed, everybody's going to be on the boardwalk.
So
if the park is open, like there's a small park up at the top of 116th Street that looks over Manhattan, from 9/11, it's closed. But there's no reason why people couldn't go sit up there and relax on a picnic bench and look at Manhattan, but it's closed. So we need to open up some open space, and people are going to go to the beach anyway. It just needs to be, people need to be responsible.
So since Walter is the owner of one of those papers over there, do you have any comments, Walter?
No, it's going to be, the beaches are closed. That's it. And the people are walking on the boardwalk. That's okay. But Reese Park is probably going to be open. So it'll be just a pretty complex situation. I spoke to John at length about it. He's fighting to get, not to make a decision till the end of the month, and that's it. Fred, thanks for that response. The wave is my paper out there, and pretty responsible, pretty beating up the mayor for making that decision early. You just have to wait and see. I mean, it's devastating to the businesses that are on the beach and wait all season long, be open and make their money in the summertime. So, we're just gonna have to wait and see. And I think an early decision is not a smart decision.
I think what you're going to see is that the federal land will be open, no matter what the city's decision is, and it's going to create a problem. John Meyer, what do you have to say?
I'm just a little confused as to why we're concerning ourselves with Board 14 matters when we're Board 5. We don't have a beach. I understand that there's some kind of, there are people that have issues down there, but that should be an issue that's raised down there.
I think it's just the idea of where are people going to recreate this summer.
I get that. But there's a lot of beaches throughout the metro region. I think that's why we've heard the governor contradict, and that's been one of those contradiction points with the mayor about closing our beaches and stuff. And as I stated and read directly from the National Park Service website, says they're working with the governors and the municipalities and all the states they're at to open up at different rates. But currently, Gateway sees itself as facilities closed. That doesn't mean that there won't be people on the boardwalks and things like that. But the restrooms and the buildings at Reese are not open.
Correct. Donald, do you have something? Donald? We lost you, Donald?
No, you made it. There it goes.
Okay. The Parks Department announced that due to budget shortages, they're going to not provide any lifeguards on the beach in order to save $12 million.
That's
correct. They don't care about people dying in the surf.
They'll just have a sign up that says, that the beach is, the swimming is closed. There's no lifeguards. You do it on your own.
Don't die here. Don't die on this beach. Die on some other beach. Yeah, okay.
They might change that. They might change that. We're fighting to change that. There being no lifeguards on the beach. That's ridiculous.
Okay.
Yeah, but if you don't train them and if you don't hire them, there's not going to be any.
I thought they were still taking applications, and they just delayed the hiring process. But that's something else. So, anything else?
It's just an open space. Like is in Juniper Park, can you walk into Juniper Park and walk around? I think you probably can. There's an open space issue. So Juniper Park, you can walk through. You should be able to walk along the beach.
Well, talk to Marianne Latanzio about Juniper Park and Forest Park, and she will rip your ears apart because there's too many people too close to each other. So it's one of those situations. Yes, people want to be out. If you open it, how do you keep people apart? You saw what happened with Mastronardi over in the 7-5 precinct the other day, trying to separate people and wound up in a dispute between the police. So now the mayor has decided that he's going to use traffic safety officers and park enforcement police to keep people separated in the parks. And it's not going to happen. It's not going to happen.
Well, Vincent, they did it yesterday. I was down in Brooklyn at Brooklyn Bridge Park, and the cops are letting people in. And they're letting them play soccer, families, and things like that. So I don't know why. I was at Principe Park 2 days ago, and there were people in there throwing the ball around. So,
well, that's what Marianne said. The cops were walking with the people in Juniper Track. you know, unseparated. So it's not going to happen.
No. We need to open up something. So, okay, I'm sure that the meetings.
All right. Is there anything else we want to discuss tonight? I just want to thank, is Crowley with us? Isn't she one of our nurses?
I am here, but I'm not working on the front line. My daughter is at Cornell, so I'm private duty nursing.
Thank you guys for everything you do. We appreciate it. Good to see you, and tell your daughter we love her. Okay.
Good luck.
Thank you.
And
I have to say something, Vinny.
go ahead.
I've been going to Rockaway Beach at least once a week with my daughter for like a mental health well-being, and there are plenty of people on the beaches and walking the boardwalk. We go to 108th Street at least once a week.
Well, that was not this Sunday, last Sunday, when I escaped from my children because they have me locked in. I drove down to Breezy Point, and when I got to Reese Park, the parking lot was full.
Right.
It was like a summer weekend, and I don't know where all those people were, so they had to be on the beach. But the federal parkland is not closed to the public. So you could say that the beaches are closed, you could say that the boardwalks are closed, but federal parkland is open. And unless the president says he's closing the federal parkland, it's going to be open and people are going to go there.
Right.
So, like I said, we have to concern ourselves with Forest Park, Juniper Park. Forest Park, for the last 2 weekends, they closed Forest Park Drive.
Right.
For vehicles. But they left it open for people to walk or ride their bicycles. So, I mean, what's the difference? You know, they in their minds they kept people from going to the park, but it's the largest natural forested parkland in an urban area on the East Coast. How are you going to keep people out of it? It's like trying to close the Adirondacks. You can't do it.
Right.
So,
Michael O'Kane has his hand.
I'm sorry?
Michael O'Kane has his hand.
Okay, Mike, what's up?
Yeah, I don't know. Can I be heard?
You got to speak louder, Michael.
Okay. At the top of the meeting, we were discussing nursing homes. At the St. Albans Nursing Home, there have been more than 40 deaths of veterans. And at the Stony Brook Veterans Home, there have been more than 60 deaths of veterans.
Wait, those two were never reported.
How do you mean?
I've been following this, and those two were never reported.
They were, St. Albans was in Newsday, been there all week. Pardon me, not St. Albans. Stony Brook has been in Newsday all week. St. Albans has been mentioned because the director out there he's not forthcoming with figures. We're concerned that there's something not up to snuff at St. Albans.
So my question regarding all of the nursing homes, yes, they're compromised people, but who's bringing the disease to them and how are they getting it?
It can only be staff or visitors before they locked it down.
So the staff is spreading disease amongst these compromised people.
That's apparently, that's my guess, yeah.
Okay. By the way, the state has a testing station at Aqueduct that you could call up and make an appointment, but it's the blood test, not the full test.
Yeah, and the blood test isn't very accurate, as I understand.
Yeah, so my doctor called me today because of my age and gave me a script for the full test, but none of the laboratories are doing the full test because the governor last week said they have to do it for free. So they're not doing it. So if anybody needs a full test, they're going to have to go to a hospital.
Yeah, I just appreciate if you guys would think about those the veterans at the state nursing homes.
Thank you, Michael.
Mary Ann has her hand up.
Go ahead, Mary Ann. Come on, girl, speak. Turn your microphone on.
Okay, can you hear me?
Yep, now we do.
City Med on, by Stop and Shop on Grand Avenue is doing the antibody blood test, and they're not taking any co-pays, because I went and I had it done.
No, they can't. It's because the governor said it's free. And that's why the laboratories won't do the full test.
But they took my insurance card.
Yeah, they'll try, but the governor said they have to do it for free.
Okay, just letting you know that they're doing it.
So if anybody gets a script or has all of the symptoms and you need to go for the full test, you're going to have to go to a hospital. Okay? Anything else we need to discuss tonight? If not, between now and the next meeting, when we figure out what we're doing, we'll let you all know. But I would suggest that be prepared for a couple of mailings or emails or phone calls for any other nominations, and then a mail-in vote, for, right, Joe Nazareno? That's what we should expect?
Yeah, we'll figure it out within the week.
All right, so we're working on it. And
Walter Clayton, Vinny?
Go ahead, Walter.
I got my hand up to make a motion to adjourn when the time.
Hold on. John Meyer had something? No? Okay. Moki, what do you, no?
Yes, I'd like to know whether the mailing would be much better to deliver it by hand to a central location, because I'm getting good mail service, but other people are not.
Well,
email.
We have to treat it, we have to deal with what is acceptable.
It has to be signed. I think it's.
I understand, but the acceptable way with regular voting is the, mail-in. So we'll see. We'll find out. All right.
Okay.
Anything else? So we have a motion to adjourn. Is it second?
I second it.
All right. All in favor?
Aye.
Thank you, everyone. Thank you, Gary. Thank you, Laura. You did a great job. And see you, Smiley.
Be safe, everyone.
All right.
Take care, everyone.
Good night, everybody. Be safe.
Good night.
Thank you. Good night.